There are millions and millions of people worldwide who have shoulder issues, but here's the tricky part. Many of them, many of us, don't realize there's a problem because you're not in pain, but you have limitation of motion, meaning that if I ask you right now, lift your arm up, go ahead, lift it up, all the way up. Can you lift it comfortably where it goes over your head, up high to the sky? Can you lift it outwards? Okay, right here is where I'm feeling my problem. When I use the other arm, no problem here. But this wasn't killing me until I get to that point. So the purpose of these stretches is to get mobilization in the shoulder joint, because a frozen shoulder called adhesive capsulitis is a capsule that starts to get thickened. You start developing scar tissue, fibrous tissue. You have the rotator cuff in there, you have the tendons, the ligaments, the nerves, as well as inflammation. And whenever we have something that's not working correctly in the shoulder, other areas surrounding that area, the neck and the shoulder blade, other parts of the body will compensate. So therefore you may be having headaches coming from your shoulder. You may notice that your motion in your neck is limited because you have limitation in your shoulder, because a lot of these muscles that affect our neck and mid-back affect our shoulder as well. The shoulder is very, very complex. So I like you to follow along with these simple exercises and stretches. They're safe, they're effective. There's lots of other strengthening things you can do later, but if you can gain your mobility back, then you're on your way to getting well again. Without mobility, without function, you're going to always have those particular problems. Remember, the longer the problem sticks around, the worse it's going to get and harder it's going to be to correct. It always makes sense to try to correct it as early as possible so you can gain those benefits and get that freedom back in your shoulder once again. And one of my favorite exercises for all shoulder problems is called the finger walk. All you do is walk up to a wall like this and take your bad shoulder that you're working on and walk it up just like this. And you'll notice you get to a point to where, it hurts. Hold it. Let the muscles ease up a little bit and work your way up the best you can. This is safe. Just walk it up to where you can tolerate it. If this is as far as you can go, then you're going to walk it down again. You're going to do about 10 repetitions. And as you proceed daily, as you walk it up, you'll notice you'll be able to go farther and farther and farther. Remember that once you get that motion, it's yours. You've got to get that mobility. It's very important. It's also a great thing to get in the habit of doing some light shoulder rolls. As you do these shoulder rolls, you're going to start isolating different muscles because you have surrounding muscles in the shoulder that are compensating from that limitation. So really get that rotation backwards. I'm not concerned about you going forwards. I like you to go backwards because most people who have shoulder issues, you're going to notice you're having rounding of the shoulders, pronation of the shoulders. Realize this could have came from sleeping incorrectly, could have been from an old injury, a fall, or just poor posture. Now, one of the greatest exercises we can do for our shoulder is a pendulum. That's right, as it moves all around just like this. Now, you can use a table, a chair, a couch, whatever you like. You got to lean over a little bit. As you lean over, you're going to let your bad arm hang. First, depending upon how bad your shoulder is, you're going to just do it just like this, the best you can with nothing in. So you're going to go in and out this way, then you go up and down, then you go a little diagonal, then you go the other diagonal. You'll just do this for a couple minutes. After, you'll go clockwise, get that rotation in the joint, and then you'll go counterclockwise. You've just spent a couple minutes going through those motions. Now, what I like about a light weight, here's a pound, okay? This is 16 ounces of water. You can hold the pound. What this does is opens the joint up in the shoulder, and now you can go front to back, side to side, angle to angle, and you can also go clockwise, and you'll feel a lot different in here with that little bit of weight. But start out really light. You don't need a lot of weight, and you're going to do that for a few minutes as well. This is extremely good to break down that scar tissue in that shoulder capsule. A towel can really come in handy to increase mobility, that if I can't lift this shoulder up, You can use a longer towel, you can use a shirt or anything that's long, that's convenient for you. But I'm going to take my good arm from behind and grab that towel. And I'm going to pull this towel back as it lifts this shoulder up. My shoulder is not working. In other words, I'm not actively using the muscles. I can let it come back down again and pull back again. Okay? So don't be afraid to use a towel. You can take this bad shoulder here and you can pull it. If you can't get as far with your hand, you can pull it out with a towel. You can pull it upwards. You can be creative. And if you have a broom or a long stick laying around, there's a few things you can do. With the shoulder joint, we want to get this mobility outwards and inwards. It's a really important motion to put back into the shoulder joint area. So we can take the stick behind us and grab it out here. Use the good arm and push outwards and pull inwards, just like this. Right against your buttocks. If I turn around, this is what it looks like. Taking the good arm on my right side and pushing opposite, left and right, and you get that nice movement in there. Also, you could take the stick with your good hand, because now we're going to go in flexion, and put them close together. And you're going to take your good arm, which is my right arm here, my shoulder I can't lift up, and you're going to use this as like a partner. So as you're pushing up, look what's happening. This is just going up without you contracting the muscle. Try to hold it up there best you can, let it back down. And the object here is to try to get more mobility each time. Don't push it. If this is all you can go, that's where you go today. But you'll notice as the days go on, before you know it, you'll be able to get it nice and high. Remember, when you get the motion, it's yours. And have that shoulder limitation that we can't lift it up or lift it out. Get a chair, get on your knees, use a couch, whatever's easy for you. Pull back away with your knees. Try to keep your elbows as straight as possible. And what I'd like you to do is drop your body down. This is my bad shoulder. This is all you're able to go right now. But notice as your body goes down, you're going to increase mobility. So right here, you're saying, oh, this is all I can go. But challenge it lightly, and as you drop your body down, you start opening up the shoulder area all within the joint, stretching the tendons, stretching the muscles. You just hold it there. What you can also do, you can lean away from it, just getting a different angle. And you can lean in the opposite direction. Because every angle you lean or move is a different angle you're going to shift and stretch in your shoulder joint. We don't really appreciate our shoulders until we start having a problem. So I'd like you to start utilizing these stretches. You can pick and choose whatever works best for you, but I promise you, these stretches are extremely beneficial. And if you're having significant pain, problem, inflammation, or it's getting worse, I always recommend to follow up with your doctor or specialist to further examine it and find out why. If it's an MRI scan, if it's other testing, whatever is medically necessary. I hope that you found this video informative. Please share it with your friends and family. Leave your comments below. And most important, make it a great day. I'm Dr. Alan Mandell.